Mental health aggression management quiz questions. Question 1. A male patient calls to tell the nurse that his monthly lithium level is 1.7 milliequivalent/L. Which nursing intervention will the nurse implement initially? Option A. Reinforce that the level is above the therapeutic range. Option B. Instruct the patient to hold the next dose of medication and contact the prescriber. Option C. Advise the patient to go to the hospital emergency room immediately. Option D. Inform the patient about the possibility of seizures and appropriate precautions. The correct answer is option B. Instruct the patient to hold the next dose of medication and contact the prescriber. A lithium level of 1.7 meql is above the therapeutic range, indicating a potential risk of toxicity. The initial nursing intervention should be to instruct the patient to hold the next dose of medication and. Question 2. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A. Selective serotonin reuptake inhibitors. Option B. Monoamine oxidase inhibitors. Option C. Serotonin and norepinephrine reuptake inhibitors. Option D. All of the above. The correct answer is option B. Monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 3. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 4. Which of the following medications is commonly used to treat attention deficit/hyperactivity disorder, ADHD? Option A. Haloperidol. Option B. Fluoxetine. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant commonly used in the treatment of ADHD. It helps improve focus, attention, and impulse control in individuals with ADHD. Haloperidol and clozapine are. Question 5. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to: Option A. Engage in a quiet meditation. Option B. Ask simple questions even if the patient will not answer. Option C. Use the technique of making observations. Option D. Simply sit quietly and leave when the patient falls asleep. The correct answer is option C. Use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 6. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive: Option A. Chlorpromazine. Option B. Phenelzyne. Option C. Haloperidol. Option D. Olanzapine. The correct answer is option D. Olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances. Question 7. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A. Shortness of breath, gastrointestinal distress, chronic cough. Option B. Ataxia, severe hypotension, large volume of dilute urine. Option C. Gastrointestinal distress, thirst, nystagmus. Option D. Electroencephalographic changes, chest pain, dizziness. The correct answer is option B. Ataxia, severe hypotension, large volume of dilute urine. The correct answer is B. Ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination. Severe hypotension indicates dangerously. Question 8. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as Option A, moderate, Option B, severe, Option C, mild, Option D, non-existent. The correct answer is Option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 9. In managing a patient with anorexia nervosa, which initial treatment goal is most important? Option A, addressing distorted body image. Option B, restoring nutritional status. Option C, resolving family conflicts. Option D, increasing social interactions. The correct answer is Option B, restoring nutritional status. The most crucial initial treatment goal for anorexia nervosa is restoring nutritional status. This is essential to prevent life-threatening complications associated with severe malnutrition, such as organ damage and. Question 10. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A, sertraline. Option B, lithium. Option C, clozapine. Option D, haloperidol. The correct answer is Option B, lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 11. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A, auditory hallucinations. Option B, paranoia. Option C, flat affect. Option D, delusions of grandeur. The correct answer is Option C, flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 12. During a manic episode, which nursing intervention is most appropriate? Option A, encourage group activities to increase socialization. Option B, provide a structured environment with limited stimuli. Option C, allow the patient to engage in physical activities freely. Option D, give the patient detailed and complex tasks to complete. The correct answer is Option B, provide a structured environment with limited stimuli. During a manic episode, individuals may experience heightened energy levels and reduced impulse control. Providing a structured environment with limited stimuli is the most appropriate nursing intervention. This. Question 13. A patient with generalized anxiety disorder, GAD, is prescribed escitalopram. The nurse should educate the patient that the full therapeutic effect of this medication may take. Option A, 1 to 2 days. Option B, 1 to 2 weeks. Option C, 2 to 4 weeks. Option D, 6 to 8 weeks. The correct answer is Option D, 6 to 8 weeks. Escitalopram, an SSRI used in treating generalized anxiety disorder, typically takes 6 to 8 weeks to achieve its full therapeutic effect. While some improvement may be noticed earlier, the maximum benefit is usually. Question 14. Which approach involves surgically implanting electrodes into specific areas of the brain to stimulate regions identified as underactive in depression? Option A, transcranial magnetic stimulation. Option B, deep brain stimulation. Option C, vagus nerve stimulation. Option D, electroconvulsive therapy. The correct answer is Option B, deep brain stimulation. Deep brain stimulation is a treatment approach that involves the surgical implantation of electrodes into specific areas of the brain to stimulate regions identified as underactive in depression. This method aims to. Question 15. In treating social anxiety disorder, which medication is commonly prescribed to patients with this condition? Option A, methylphenidate. Option B, sertraline. Option C, lithium. Option D, haloperidol. The correct answer is Option B, sertraline. Sertraline is a selective serotonin reuptake inhibitor SSRI commonly used to treat social anxiety disorder. SSRIs are a first-line pharmacological treatment for social anxiety disorder due to their effectiveness in. Question 16. During cognitive behavioral therapy, a 12-year-old patient reports to the nurse practitioner. Option A. I was so mad I wanted to hit my mother. Option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. Option C. I forgot that you told me to breathe when I become angry. Option D. I scream as loud as I can when the train goes by the house. The correct answer is Option B. I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. In cognitive behavioral therapy, recognizing and challenging negative thoughts is crucial for progress. Choice B demonstrates the patient's ability to identify and correct distorted thoughts, indicating positive. Question 17. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A. Constantly afraid another student will steal her belongings. Option B. An unusual interest in numbers and specific topics. Option C. Demonstrates no interest in athletics or organized sports. Option D. Appears more comfortable among males. The correct answer is option B. An unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 18. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A. Flashbacks. Option B. Nightmares. Option C. Hypervigilance. Option D. Depression. The correct answer is option B. Nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of. Question 19. Which assessment question asked by the nurse demonstrates an understanding of comorbid mental health conditions associated with major depressive disorder? Select one that doesn't apply. Option A. Do rules apply to you? Option B. What do you do to manage anxiety? Option C. Do you have a history of disordered eating? Option D. Do you think that you drink too much? The correct answer is option A. Do rules apply to you? Questions about anxiety management, disordered eating, and alcohol use are relevant to identifying comorbid conditions with major depressive disorder, but the question "Do rules apply to you?" does not directly. Question 20. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A. Monitor the patient's vital signs frequently. Option B. Keep the patient distracted with group-oriented activities. Option C. Provide the patient with frequent milkshakes and protein drinks. Option D. Reduce the volume on the television and dim bright lights in the environment. The correct answer is option B. Keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable, providing nutrition, such as milkshakes and protein drinks. Question 21. Adolescents often display fluctuations in mood along with undeveloped emotional regulation and poor tolerance for frustration. Emotional and behavioral control usually increases over the course of adolescence due to Option A. Limited executive function. Option B. Cerebellum maturation. Option C. Cerebral stasis and hormonal changes. Option D. A slight reduction in brain volume. The correct answer is option B. Cerebellum maturation. Adolescence is marked by significant neurodevelopmental changes that influence emotional regulation and behavioral control. The correct answer, B. Cerebellum maturation, is supported by research showing that the. Question 22. Which therapeutic intervention is most effective for social anxiety disorder? Option A. Group therapy. Option B. Behavioral rehearsal. Option C. Cognitive behavioral therapy. Option D. Medication management. The correct answer is option C. Cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is considered the most effective therapeutic intervention for social anxiety disorder. CBT helps individuals identify and change negative thought patterns and behaviors associated. Question 23. In a patient with bipolar disorder, which symptom would indicate a manic episode? Option A. Excessive sleeping. Option B. Low self-esteem. Option C. Decreased need for sleep. Option D. Anhedonia. The correct answer is option C. Decreased need for sleep. The correct answer is C. Decreased need for sleep. A decreased need for sleep is a hallmark symptom of a manic episode in bipolar disorder. During manic episodes, individuals may experience significantly reduced. Question 24. What should the nurse include in patient education for a patient starting on bupropion for major depressive disorder? Option A. Avoid consuming alcohol while taking this medication. Option B. Take the medication in the morning to prevent insomnia. Option C. It may cause significant weight gain. Option D. It is used as a first-line treatment for anxiety. The correct answer is option A. Avoid consuming alcohol while taking this medication. Patients prescribed bupropion should be educated to avoid consuming alcohol while on this medication to reduce the risk of seizures. Bupropion lowers the seizure threshold, and alcohol can further increase this risk. Question 25. When providing care for 10-year-old Harper diagnosed with post-traumatic stress disorder, PTSD, which goal should be addressed initially? Option A. Harper will be able to identify feelings through the use of play therapy. Option B. Harper and her parents will have access to protective resources available through social services. Option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. Option D. Harper and her parents will demonstrate an understanding of the personal human response to traumatic events. The correct answer is option C. Harper will demonstrate the effective use of relaxation techniques to restore a sense of control over disturbing thoughts. The initial goal when caring for a child with PTSD like Harper is to address restoring a sense of control over disturbing thoughts by teaching relaxation techniques. This approach helps the child manage their